6, 5, 4, 3, 2, 1.
Hello everyone! Luzon, Visayas at Mindanao. I am Dr. Shi Armero, your friendly OBGYN and lifestyle medicine physician, and you are watching Dangpanan, a Doc Shi TV live health talk series. If this is your first time watching, we do this training regularly and simultaneously in Facebook and in YouTube, Doc Shi TV. So if you're watching from YouTube, please click that subscribe button and turn on that notification bell for you to be notified on future videos. If you're watching from Facebook, click that follow button and share away. The goal of this program is to get in touch with you, modern Filipinas, to various social media platforms to empower you to take charge of your health through correct and science-based information. Dangpanan, a Bisaya term for shelter, is chosen to be the name of this program because I want to share this shelter of comfort and good education to you, my dear viewers, through a platform that is accessible to all. Welcome to another educational health talk. And what's more, you do not just learn. Lucky viewers will also get a chance to win a free online consultation coupon. So, stay tuned till the end because you might be today's lucky winner. So invite your friends by typing their names in the chat box and click that share button. Don't forget, ako ang inyong Dangpanan, hashtag Dangpanan DocShi TV or hashtag DDS TV.
Dangpanan, kabahin sa panglawas o relasyon. Doc Shi Armero.
Hello, good evening, good afternoon, good morning to all our viewers. Yay! We have early birds in the room. Hello, Angela. Thank you for being with us. Hi, Merlin. Thank you for tagging all your friends to be with us tonight. If you are our first time viewer in Dangpanan, I would love it if you can type in from where you are watching right now so I can say hi and good evening to you. Today is a wonderful start of October as we embrace the Breast Awareness Month. We will be talking about breast cancer. And hi, Jai, also mentioning friends. Thank you very much. Oh, there are some more. Thank you. Good evening. Yes, from where are we watching? So I can, wow, from Panglao, Bohol. Thank you to all our Bulanon watchers. Thank you very much for being with us. Hello. Saan po tayo nanonood? Please let me know if my connection is not very good. Sabi dito, yung signal ko hina. Just interrupt me anytime. Okay, all right. Okay, good evening, Doc. Hi, watching from Cebu City. Thank you very much for being with us tonight. Also, yes, good evening. Oh, okay. We are having um very varied yung ano natin, audience natin ngayon because we are expecting students to come in because our guest is quite popular to our students. Yun nga lang. Oh, hello, Nars from Dalaget. Thank you. It's just that, yes, good evening, Muhammad Sarohan. Thank you from Cebu City. Hello, Tin, watching from Cagayan de Oro. Thank you very much. Okay, so I will do the hi and hellos because it would really be wonderful to say hi to all of you. And since you are not face to face, it would be nice to be seeing your names. You are mentioned. uh, be with us. Hi, March. Thanks for watching. Okay, so yes, we are quite a lot tonight, and I would please help me pray because Dr. Habagat is really having a hard time connecting with our platform. But you know, he's quite techy naman. So let's chill. He'll be in a while. Hello, good evening. Wow, ang daming YouTube watchers tonight. Hello, also Kara watching from Cebu. Okay, ayan. Okay, I hope I'm not missing anyone. Okay, but before we start our health talk tonight, I would invite all of you first because as we celebrate again the Breast Cancer Awareness Month, if you have watched our previous breast cancer awareness videos, it has always been that exercise is one of the preventive strategies for breast cancer. And so I would like to take this opportunity, especially that many of our students are watching us tonight. I would like to take this opportunity in coordination with the Catholic Medical Students Guilds of the Philippines. We would like to invite you all for another walk with me this Saturday, October 15. We change this time slot. Tingnan natin pag if mas marami ba no ang afternoon. So it will be Saturday at 4 p.m. and change venue din. Because nga, this is in collaboration with the Catholic Medical Students Guild. These are the medical students that we are hoping to mold and become future physicians. And they will be joining us together with some other students. If you are available on Saturday, October 15, please be with us for another walk with me. If you're wondering what is walk with me, it's actually Dokshi TV's Move to Move. It's just a walk, an exercise, and at the same time we talk. There will be a health talk that you will have after the exercise, after the walk, and it will be with our walk leader, Dr. Shawnee Halad. I'm afraid they are not with us tonight. Usually, my parents also watch when I have live panan. However, they are also quite busy with a lot of things there in Bohol. So hello to Mama and Papa. If you'll be watching this later, I'm saying hi and I'll see you over the weekend. Yes, hello, Marietta. Thank you, Maria. Thank you for being with us. Okay, again, I will introduce Walk With Me. And I hope you will enjoy the video that my daughter Nick prepared. These are just a group of videos that she prepared so that you will know what Walk With Me is about. Okay, ready? Let's go. Okay, one more.
big hand to my daughter who made that video. She's really good with that, no? Hi, Aisel. I miss you. I delivered Aisel. I hope she is well already, Tin. Okay. Hi, also Grace from Bohol. All right. So we have, without further ado, we will go to our lecture already on breast cancer, and I am very proud and so honored to introduce our guest speaker tonight. He's been in the teaching profession for 25 years, so that means I'm also one of his very proud students. I'm my very good friend. He's the chairman of the Department of Surgery in Southwestern University Medical Center, the very active, very handsome, smart, lahat-lahat na medical director of Southwestern University Medical Center. Help me welcome the only Dr. Elmer Magbagat. Good evening, Doc.
Hello, good evening. Sorry, I got in late kay technical problems.
Also, Okira, it gave us time to introduce also Walk With Me. He is also one of our advisors of the Catholic Medical Students Guild. A lot of our students are with us tonight. And so I'll give you the floor to start with your lecture on breast cancer. Doc, you might want to say hi. Baka gusto mo mag-hi to our viewers first before you do your lecture.
Yes, hello. Thank you for being with us. I also like to thank Dr. Armiro for inviting me. Over the last, I don't know, 20 years or so, every October, I really do nothing for the entire month. And so much so that I sometimes miss very important family activities because of this. I thought
Oh.
I have gone over it because there are younger surgeons now who are into this, but I cannot say no to Dr. Shi
Doc!
to
Thank you, Doc.
discuss. Now, we did this way before every October. So, thank you for being here, and we will, I mean, on my part, and with the help of Dr. Shi, I would like to part you something about breast cancer screening. Now we are in the peak October month, which is the breast cancer
Mhm.
awareness month.
Okay. All right.
So, ikaw ang mag-control. You control
Oh,
the
can you
slides.
control, Doc? Can you see the control?
Mandapit. Sige, where?
At the bottom. Can you see?
Can I present? Can I present?
The slide at the bottom. It's already in the screen.
Dili mo klaro. Anyway,
Sige. Anyway,
Ah.
I'll do it. Go.
sige. Breast cancer, as we all know, is, I mean, for all of us to know, for our awareness, one of the top cancers among women. It's being surpassed only in terms of incidence by lung cancer. So for women, it's number one. Actually, lung cancer being a cancer that affects mga babae o mga lalaki. But for women, this is number one, breast cancer. Now, another thing that we have to realize is that breast cancer is very common, especially among us Filipinos. Among the Asian countries, Philippines has the highest incidence of breast cancer. So it's very important that we become aware of these facts, and then we will know what are the screening maneuvers, because there are no primary preventive measures that we can do, meaning, like, for example, for lung cancer, which is the number one cancer, one of the primary preventive measures that we can advise, since it's strongly associated with smoking. So our preventive measures that we promote, we espouse, is stop smoking. But we can't do that in breast cancer because we don't have very strong risk factors, except for being a woman who has grown older. I mean, we cannot prevent that. So, but of course, we have secondary preventive measures, and it's the secondary preventive measures which has helped us so much in in discovering the breast cancer disease as early as possible, because it's always an advocacy, especially during Pink October, that the earlier the better. The earliest time that you discovered breast cancer, the very early stage, there's a great chance that this can be cured.
All right. So,
Okay,
Doc,
so yes,
how
sige.
old is the earliest time that we can do the secondary prevention that you are telling us?
Okay, pwede akong i-kuan later. I would just
Ay,
like to
sige. Sorry
aron
naman.
na background. Aron na tayo background. So, as a backgrounder, ang risk factors for breast cancer in are anything that is hormone related, because ang breast
Mm.
cancer po is related to female hormone. That's why, although it's can occur in males, but in very rare, and the incidence is very rare, about 1 in 100, no, 100. Sara kabuk ang babae. So the risk factors are actually, this is so because the risk factors are associated with the fact that it's the females who produce estrogen, and it's estrogen is the hormone, female hormone, that is the one of the primary stimulation or stimulus for the breast cells to undergo division, and in the process, some of them mutates into something that is already abnormal and becomes malignant. So anything that increases the woman to increased hormone exposure, like for example, early menarche meaning sayogi,
Maaga na
maaga.
dinatnan.
ah, so normally, di ba, Dr. C. Armero is an OBGYN, I think mga 12, no?
Yes, that is the
So it means,
ideal age.
so 11, 10, it's already considered menarche. Women who
Mm-mm.
have not born any children, never been pregnant. Because during pregnancy, the secretion of estrogen goes down. So the exposure of
Yes.
a woman to estrogen is also diminished. Now, late menopause, normally I don't know if you agree, Dr. Armir, menopause come at around age 50.
That's correct.
Oh, so late menopause beyond that, that's late menopause. So, like, take for example, a woman who had her first menstruation at the age of 10 or 11 and then had her menopause at 53 or 54. That means over that long period, na-expose siya sa estrogen.
Mm-mm.
That will expose her to an increased risk. Especially haven't been pregnant or haven't delivered a baby. And you go to the next line.
Okay. So, in other words, Doc, liban sa risk because we are female, mga babae kami, risk din pag maaga, nagkaroon ng menstruation,
Yes.
pero pag late din, nawala, is risk also.
Yes.
Lalo na if hindi ever nabuntis.
Yes. The reason
Okay.
again for that is during
Estrogen exposure.
is the estrogen exposure.
Mm-mm.
Now there are other risk factors that are associated with it. Pero I'll tell you that these are just risk factors. Doesn't mean that if you have this, you will get breast cancer.
Magkaka-cancer ka.
Yeah, risk factors lang. Actually, the incidence of breast cancer in the Philippines, as I mentioned, is very high, about 3 per 100 women. That's very high already. In fact, that's the
Mm-mm.
highest in Asia. We're higher than Japan. So
Oh
obesity,
my.
because obesity, that means you have a lot of fat in your body. Estrogen is a fat hormone. It's estrogen. It's a lipid hormone, lipid type of hormone.
Mm-mm.
Older age at first birth, it also is associated with increased risk of pregnancy. Can you go to the next
Ayan.
slide?
Sure.
Okay. Now, there are other
Mm.
non-hormonal factors, example, radiation exposure, like when you are a child who had cancer during childhood, and part of the treatment of the cancer is radiation to the chest, for example. That means that the breast becomes exposed to radiation. Radiation is one of the well-known factors that can cause mutation in the DNA of the cells, and these have been noticed, observed in the survivors of the atomic bomb blast in Japan before. But these are again things that is not very common. It's not, we are not really exposed to radiation, all of us, every day. There are just some patients who are unlucky, and no unlucky part, for some reason have been exposed to radiation in the past.
Mm. Eh, cellphone nga eh. It's exposure to radiation na, di ba?
Pero I'm not really sure about the amount of disease.
The extent.
Sige.
Sige, okay.
Go forward. Okay.
Ayan,
Even
alcohol.
alcohol consumption is associated with increased risk of breast cancer. Because alcohol consumption is known to increase the serum levels of estradiol. So Dr. C. Arbero can explain to you what estradiol is. This is, again, estrogen, related to estrogen production in a female. But by the way, as I mentioned, males can also get breast cancer, but very, very rare. Yeah, very rare.
Yes, because both male and female, we have estrogen. It's just that mas madami talaga yung amin kaysa sa inyo because it's just testosterone hanggang most of the majority of the hormones hanggang testosterone for the male. Eh, kami lahat, kahit testosterone namin, naka-convert into estrogen. So we have that innate capacity to welcome all the estrogen in the world.
So sa synthesis ng estrogen, they all become before going to becoming estrogen. Pero sa mga lalaki, hanggang testosterone. So anyway, those risk factors that I mentioned doesn't really spell out to the later on you will get breast cancer. They are just breast cancer for us to know that if you have those, then you have to be very careful. So if you have those, you have to be very aware and submit yourself to the screening procedures, the so-called secondary preventive measures. Because the fact is, about 70 to 80% of breast cancer. So that's about 7 to 8 in 10 of patients who get breast cancer. We cannot identify those risk factors that we've mentioned. The risk factors that are clear-cut, you can see, is that she is a woman, nag-age.
So mapapatanong na lang tayo, bakit? Why?
Bakit? Why? We have a lot of patients na wala mo ko'y kaliwat, wala akong they develop breast cancer. Okay? Anyway, I would like to just mention this. This is something I teach the student. The Gale model. This is a you can even download the app on your cell phone. It's we use as a guide to compute for the risk for a specific individual. So na questions age at midnight, how old are you? Then each item here is given a specific score. Then if you total the score that you have, and then you are given by that app. You used to have a book karon na app sa cellphone. Gale model na lang. Then it will give you for the next 5 years your risk for breast cancer is this.
So mahanap nga yan. Sige.
Can you skip that kay technical kayo?
Ay, yes. Yes po. Okay po.
So anyway, there are also cancer types that are have very strong familial tendencies, meaning na inherit. Now, these are the people who have mutations sa genes na sa DNA, the BRCA1, BRCA2. This is not the most common type of breast cancer that we see. Most common, before I go into that, there are 3 types in terms of incidence and heredity. There are 3 types of breast cancer. The first one is sporadic. Sporadic meaning walang history. Walang history sa family, nothing.
Bakit? Ganun lang.
Siya ang unang nagkaroon ng sa family. But there are, that's most of the time that's the most common, about 80%. The rest are those who are familial, meaning may mga members of
tita, mommy,
and when we
lola.
say family, yung mga first degree sa linya ba, yung mga
so
like
kapatid.
for example, mother and then sisters.
Okay.
Because they have almost the similar genes. But
Mhm.
if you look at the specific gene, you cannot identify. But sa familial lang. But this one, it really is hereditary. The BRCA1, these are identifiable mutations in the DNA sa pasyente that we can identify. And we have means to identify this. We can send the specimen to the laboratory and identify this. Now, if a patient has this, it's 100% that in a few years, magkaroon siya ng breast cancer. And these are the patients who are going to have breast cancer at a very young age and
Mhm.
most often bilateral, right and left. Oh, basta naan na siya.
So,
So,
meron tayo dito sa Pilipinas nito.
I think
How
naa sa
much? How
subscribers.
much?
I don't know how much, but I know it's very expensive.
Okay, di
So,
ba po si
yeah,
Angelina Jolie, parang
yes.
ganon,
Oh,
parang BRCA
yeah.
carrier. Oh,
Yeah,
ikaw showbiz
BRCA1, yeah.
ka.
Oh, yeah. Oh, di, nananghid siya na ako before siya nag-confirm. Anyway, so we only request for this testing if we highly suspect that the patient is a carrier of BRCA1. So, ano naman when are we going to say kailan tayo maging suspicious na ang pasyente ay BRCA, we call this BRCA1,
Carrier.
BRCA2 carrier. The patient is very young, nagka-breast cancer, or a patient is 40, 30, late 30s, 40 years, but bilateral breast cancer. So we always think probably this patient is a carrier, has a gene. So when it's present, kung meron siyang ganyan, then dapat lahat ng kapatid na babae, we have to screen.
Screen.
Yes. That's
Mm.
what happened to some of the mga actresses na nag-prophylactic mastectomy.
Mm-mm.
Because this is what we do when they are positive for these genes. Prophylactic mastectomy, meaning we remove the breast before cancer happens, and then we just do reconstruction. Or we can do prophylactic oophorectomy, meaning we remove the ovaries, and then give the patient hormone replacement therapy. So mo lang na problema. And of course, if the patient will not subject to that, just intensive surveillance. But we are sure that eventually, 100% pa na
She will.
incidence, she will get breast cancer. It's just a matter of, ang question lang, when?
When? Kailan? Mm-mm. Hindi na
When?
bakit. Alam na ang
Hindi na
bakit.
bakit.
Ang kailan ang sasagot.
Okay, so this is as I mentioned, number one cancer in women, and in the Philippines, the Philippines has the number one in terms of statistics, number one siya sa Asia. So it's no longer, it's no longer just you're a woman who's gotten older, you are a Filipino.
Mm-mm. Parang diabetes din. Pag ikaw Pinoy ka,
Filipino.
ayan.
Sumukaon ka, tuminom og coke. So anyway, ang purpose yun sa Pink October or breast cancer awareness is to get the disease at the early stage, because it's at that stage that we can do something to really cure it. Na gyud siya, ma-remove. Because ang breast cancer we have a lot of treatment modalities we can offer. And in the end, we don't want to see this, look at these advanced breast cancers. We don't like this. It's really a lot of unnecessary suffering. Sometimes when we see this patient, if we have only gotten hold of this patient at a very early stage, then we can send her back to her family. But look at this. So, Philippines is the highest incidence of breast cancer. This is an old data, but according to si OBGYN, ang utana ko yesterday, si Dr. Albanio. Ayan siya, napakay bagong data. I think in 2017, which is published in the journal Philippine Obstetrics Gynecology, the incidence, the recent is 3 patients per 100. No? Mas
Yes.
daghan.
Per 100? Oo,
Per 100.
Mas madami.
Yes.
Correct.
Kay more and more are being diagnosed, discovered now, because the patients are becoming more and more aware. Okay?
Yes.
This
is the good thing on awareness programs like this.
So, breast cancer it actually starts from a mutation in a single cell. Gamay kayo. Single cell, it cannot be seen, it cannot be palpated, the patient will not feel anything. This time is going to be very difficult to detect. And then over time, depending on how aggressive ang cell, it will double exponential ba? Until such a time that we can palpate it. The smallest size that where the tumor can be palpated is when it reaches about 1 centimeter. And then it, kanang serous type, this is actually a technical term, murag mascar siya ba, murag mag-scar. That's why when you hold it with your fingers, palpate it with your hands, o siya bato, gahi, parang bato, matigas.
Mhm.
So that's sometimes mayroon ng pasyente sa clinic, "Doc, are you sure?" I'm really not that 100%, but I'm almost certain, almost lang, because I've
Mm-mm.
seen a lot and
Touched
all
it.
its face like, yeah. It's the biopsy that can be 100% sure. Sige,
But
continue.
with all the patients that you have examined, even just a touch, you will know na, di ba?
We have a strong suspicion na because there
Mm-mm.
are other signs which
That's
we
great.
can show later on, like kani. These are the signs, no? Kani, one of the slides that I have always shown over the past 20 years. Kandi ison nga panit. So there's a recent dimpling.
Dimpling.
Recent, yeah, dili ni siya since birth. So nindot ra sa una dayon over the past few months anay dimple ang kwan. So dili ni siya nindot tan-awon nga hindi dimple to look at. Diba? Dimple si Dr. Almero and smile na dimple. But this one
I
is
don't have.
this one is should be a cause for alarm. Uy, may
Mm-mm.
bagong dimple sa breast. Na alarming na siya. Okay, can you
Mm-mm.
next slide? Okay, until when it reach ang appearance is something like this. It becomes like the peel of an orange. We call this peau d'orange, French, or orange peel appearance. That's already far advanced. Muna,
Oh
mga
no.
pasyente maabot sa clinic, yan ani sus nga nung ipaabot maligin ani. This is a very far advanced breast cancer involving the skin already. Can you move forward? Or kani ulceration sa mud, no? Sugat na hindi sa heal, gumaling.
Hindi gumagaling.
Several,
Correct.
but rather it goes larger and larger. Actually, that's
Mm-mm.
the term cancer. Actually, cancer is crab, diba? Cancer is crab. It was first applied to breast cancer before. It was during the time na walang treatment. Because they noticed, parang crab, yung edge ng ulcer going sideways. Similar to how a crab moves, going sideways,
Crawls.
going larger. Oh, a crab crawls. So that's why they call it parang crab daw, but that's why they call it cancer actually. So anyway, but when you see this, means it's been there for long. Tagal na. Sometimes it's far advanced already.
Oh no. Okay.
And okay, the size of the primary breast cancer correlates with disease-free survival. That's why it's very important that we get the disease, most especially
Early.
hindi pa makapa,
Ma-
hindi pa
oh, okay.
hindi pa makapa. Walang
Hindi pa nakikita.
hindi pa nakikita, hindi pa na feel sa touch.
Ah.
That's the best. That's the best time that the breast cancer can be treated because the prognosis that time is very good. We can control the disease at the early stage, and we have means to do that. When I say secondary preventive measures.
Perfect.
Okay. Kaning uban nga slides are actually. So this is how a breast cancer is natural stages of breast cancer. Starts from a single cell, it gradually doubles until it becomes 1 centimeter. When it reaches a 1 centimeter diameter, then that's the time that's most likely palpable. And from there, it will invade kanang mga lisay-lisay,
Kulane.
goes to the siya na Tagalog sa lisay-lisay, lymph nodes sa English. And then the first, most commonly, the first lymph nodes that they will travel to or migrate toward are the lymph nodes in the ilok or axilla or kilikili.
Mm.
And from there, and the primary tumor, some of them will invade the blood vessels and then reach the bloodstream and then travel somewhere else. Now, the lymph nodes in this case, that's stage 2 already when there are lymph nodes. And when they already involve the skin or the lymph node become enlarged, it's already known as stage 3. So further, because the cancer cells can easily be detached and carried by the bloodstream or the lymph nodes or back into the bloodstream and then can transplant cells, they will find their way to other organs in your body and then they really have their ability to grow. Parang seeds. You plant the seed, they grow. So when they reach distant organs, they have this very, very nice or strong ability to grow into another tumor. So most commonly, the size where they grow includes the lungs, the liver, and the bones, eggshell bones, including the skull. So when that happens, that's already very late. That's stage 4. So the survival also depends on the stage and the ability to cure. For stage 1 disease, especially less than 1 centimeter, meaning dili pa mapalpate, the the chance that it can be removed completely is very high. So if you can do that, then you can offer 100% cure, the most. Kanangkat man jud. But the very late stage, wala na say cure. So we sometimes refuse even surgery. Muna, tambal na lang, chemotherapy. Now, in between stage to stage, it depends. No? We can do surgery, we can do chemotherapy and surgery, or chemotherapy first and then surgery later. But the prognosis is not as good as when you get a patient who has a stage 1 disease. So that's why it's very important to discover this problem at the early stage. Ano siya ay pink cancer or pink October awareness objective. Okay. Oh, yeah. This is the summary. Tumor. But again, these are all late signs. Simple bloody nipple discharge. Not all bloody nipple discharge is cancer. And bloody nipple discharge are benign. But you have to be sure na
Consult.
dili siya cancer. Yeah. Consult kay simba po di ay. Although the most common cause ng bloody nipple discharge is benign. Non-healing as kani apil ni this one is included. Retraction of the nipple. Very recent retraction of the nipple. Like for example, last year the nipple was protruding, and then a few months ago, 2, 3, 4 months ago, the nipple is retracted. Something is pulling it down. Cancer can pull down on the nipple. That's why recent retraction or a recent asymmetry. Taas ang usa ka tutoy or the affected breast is pulled by the tumor and becomes smaller, more shorter. Or taas ang pikas and uneven ang iyang breast. But very recent, dili na since puberty, nagyud na iyang tutoy, recent pa, changes. Then that should bring ring alarm bells for the patient. But as I mentioned, again, these things are late signs. The best time to treat this is the early sign when there's no bugon yet. There's no bukol yet. That's the best time, John. Okay. So what are the techniques we can use so that we can discover the disease at the early stage? Ano ang mga secondary preventive measures? Actually, tri-prong na siya. Tulo ka prong ba? Number 1 is self-breast examination by the patient starting at the age of 20. Then clinical breast exam, meaning you go to the doctor once every 6 months, for example, during the first one. Then you can do it annually starting at the age of 30. Then at the age of 40, you start your yearly mammogram. So, even if you don't have strong family history, recommendation is mammogram at the age of 40. But if you have a very strong family history, you start your mammogram at the early age. So,
What I know, Doc, is 30 years old. That's for
Yeah,
the pogs. That's the age we recommend. I don't know if it applies to surgery.
yeah, this is taken from the American Oncology Society and American College of Surgeons. And this is also the recommendations of Philippine College of Surgeons. Kay ang unless there's a very strong
Yes,
family
for those with what's this? Family,
sister,
immediate
mm,
family, first degree, 30
first
30
degree.
years old. Yes, but for the general, 40 years old.
Okay. But if kung usually ang age nga among i-recommend sa how early,
Oh,
you ask the patient how old
how
was the
old?
sister when diagnosed. Like for example, the sister was diagnosed at 30 years old, very early, no? So
Yes. So,
you start screening procedures
at how
5 years
old?
before that, 25.
Oh,
But ang
okay.
problema lang sa 25 is the breast of these patients is going to be dematos bata pa man. So the
Yes.
recommendation actually is sonomammogram. But
Okay.
if really, or if it's really high risk, the patient is really high risk, like you're suspecting BRCA1, BRCA2 positivity,
Mm-mm. Mm-mm.
MRI is recommended. That's better. It's a better sensitivity
Imaging. Mm-mm.
imaging technique. Problem is, it's very expensive. That's why it's not recommended for all. But for the general population, it's 40. And then if it's negative, nothing is seen, you repeat that 1 year after 41. Still negative, you repeat another one at 42 years old. Still negative, then you can do it every other year.
Okay.
Ay wala man. Nothing has shown. So every other year na lang.
Pero kung kunwari in the mammogram, it says um probably
Probably.
benign. Oh,
Probably
when do
benign.
you
Oh, ang
oh,
mammogram result, good. I think na ako I don't know.
ay,
Mammogram
wait
result,
lang.
ang mga radiologists or the one who will be reading this, the doctors who are going to interpret the results, na sila scoring.
Yes.
And then they grade it. Then they report it as by RADS 1, by RADS 2. Ay, ano na itsura sa mammogram. Actually, a mammogram is just an X-ray look. Yung breast, butang sa X-ray. Ano yung rad tech. This is how it's done. And then, it's just an X-ray of the breast. And this is how it looks like, right? Left breast. And then, naana siya signs there. Tawag lang microcalcification, irregular
Mm-hmm.
borders. They will have strong suspicion it's malignant. So, that is by RODS 1, 2, 3, 4, 5 is yun sila, highly suspicious malignancy, most probably malignant. Recommendation, biopsy. But if it's 1 or 3, man, it's really benign. So the radiologist will interpret that for the patient and for the doctor. Now, in my personal experience, when I get a mammogram and
Mm-hmm.
it says 3, and then I will do my physical examination, and
Mm-hmm.
there are characteristics. There's negative family history,
Mm-mm.
characteristic of a benign, and it's very small, well circumscribed border. So I just say we'll just observe this. But some patients are really kuan ba, so anxious.
Anxious.
So we sorry ha,
It's okay, Doc.
anxious kayo, then I recommend sige, let's submit that so that we can prove that it's really nothing, makapahuway,
Pero kung
maka-relax.
pagsabihin, Doc, na paano kung i-repeat na lang natin para makita mas
Yeah,
surely? So how soon 'yon? How soon uulit sila?
they will
Kasi 'di ba
they
dapat
will
yearly, 'pag
yeah,
wala
yearly, pero I tell them to come back after 6 months, but for physical examination lang, and then do another
okay.
mammogram after 1 year. But if I
Okay,
the report says 4 or 5, matter how
biopsy
small,
na,
even if it's kahit hindi
kapa.
makapa, oo, I always recommend let's do a biopsy. Even if it's not palpable, hindi makapa, there's a way of doing a biopsy. Meaning by using a mammogram as your guide, you insert a needle, a long needle towards the area where the abnormality is seen. and then with the needle still in, you bring the patient to the operating room and then have that needle as your guide. Excise mo ba on a needle.
Mm-mm.
After that, you remove that, you get the specimen, and then subject the specimen to the mammogram again to just to verify that you have removed that area that was seen before, and then send it for biopsy. I've done also that. I've also done that several times, or an ultrasound guided biopsy, meaning use an ultrasound, direct the needle. You can see the needle using the ultrasound going into the suspicious tumor, and then get a biopsy sample. So there are
Okay,
a lot of ways.
since you mentioned those techniques, Doc, ano bang what will our patient expect pag sabihin tong fine needle aspiration? Masakit ba? Mag-anesthesia ba? Dapat sa operating room
Okay.
ba? Ganon.
Yes.
Mm-mm.
Oh, sa breast cancer before when I was still younger, ang recommendation for biopsy was fine needle. The usual needle that is used for injection, similar to
Mhm.
the needle we use for injecting our COVID vaccine. And then you
Mhm.
aspirate, and
Okay.
then send a specimen. The aspirate is spread on a glass and then sent to
Mm-mm.
the laboratory for reading. Now it's not recommended anymore because what you see are cells. Now, if it's cancer, you really need to see a thick layer of tissue. You can see the invasion man. So now the
Mm-mm.
recommendation is core needle. Core needle.
Mm-mm.
So bigger needle, dako siya. Thick, mahal-mahal lang. And we use local anesthesia for that. So generally, it's non-painful, but it's going to be when the effect of the anesthesia will win off. Sakit kamay, but the opening is very small. So if is no longer this is fine needle aspiration biopsy. Before, when I was younger, we used to do this. Walay sa mud. Now we recommend core needle. This is the now the gold standard core needle biopsy. We can do this and then under local anesthesia. Or if the tumor is really very big, the patient cannot afford the core needle because mahal man ang core needle, I think 2,000 plus. O pailabot sa laboratory. We just do an open biopsy, anesthetize the skin, make an opening, and then get a small sample of the tumor. Send it for biopsy, an open biopsy.
So in other words, we can do this kahit sa office setup for
Yes.
ECNAB and then core needle.
Core needle. We can do this outpatient rin siya. Actually, we do this in a breast clinic of Southwestern.
Yes. The open biopsy, di ba we can also do it as
Yes,
outpatient?
outpatient. Yes.
Oh,
Outpatient. Outpatient ra.
okay.
Because
Mm-mm.
these are minor procedures pa. Oh,
Okay. Because apart from the diagnosis, takot din ang patient sa procedure. So at least it is clear
yeah.
that outpatient siya. Okay.
Patient dili ra i-admit.
Okay. So meaning mag-anesthesia tapos uuwi.
Yung local anesthesia yung lang, yung area na may
Inject.
tumor, yun lang i-anesthetize.
Okay.
So,
yan.
this is now the objective of the Pink October movement or Breast Cancer Awareness Month because early detection saves lives. Mga gina recurrent since 20 years ago until now, early detection saves lives. Early detection is the key to cure. So what are these? Starting at 20 years old, you have to learn, each woman should learn how to do breast self-examination.
Yes.
I saw a very recent post sa Facebook sa Philippine Society of Medical Oncologists. Same, nothing has changed. So
Yes.
how to do this? This entails another workshop if you really want, but this is usually done every month, regular date, meaning specific date. So what is the recommended date? Should be 5 days to 1 week after menstruation because it is at this time that your breast is not so busok.
It's not
Or it is
painful.
not
It's not
painful.
painful. And then
After,
the hormones then are low
so the
because
breast will
galing
not,
menstruation.
dili siya engorged. So you can
Mm-mm.
feel anyone. If you do this, actually, we're not really expecting that you will discover breast cancer at this early age. Dili man siya common age. It's usually about 40 and up. But if you do this regularly, every month, dali naman yung mga less than minutes, you become so aware of how your breast feels like that any subtle change, the mga changes, you can immediately detect.
Catch.
You can early catch them and then go to a doctor for verification of your findings. Okay, starting at 30, then you go to a healthcare worker for examination. Just once a year lang. So healthcare worker kasi Dr. Aramiro, pwede kay BGYN man siya, or a surgeon, or even a nurse or a barangay health worker who knows how to do this skill man sa ni siya kanang systematic examination sa breast skill.
Yes.
That
In
has-
fact, Doc, ang ginagawa ko, when patients come for the yearly pap smear,
Mm.
nag-i-examine na din ng breast. Para isa na.
Yeah.
Kasi di ba
Okay.
yearly.
Yes.
Yan.
Di ba, cervical cancer is also common among. Okay, then as we have mentioned a while ago, mammogram is recommended at the age for the general population. But if you have a very strong family history, it's recommended at the earlier stage, depending on at what age was the family member diagnosed. Diagnosed at 35, then at 30, you start your screening already. Okay.
Ayan. Ay, ribbon
na
na
siya.
po.
Anyway, that's the entire gist of Pink October. Early detection saves lives, breast cancer awareness, because of the fact that in the Philippines, we have the number one incidence in the whole of Asia. It's really very common. Like, for example, the past week, I think, dalawa, I did surgery on 2 patients. And then the previous week, yung sa group lang sa Southwestern, there was another one. And then,
Yes po.
and then last Thursday, 2 ladies who came to the clinic with the same complaint. Then when I looked at the first one, it's really hard as a stone, a rock,
Oh no.
42 years old. And the other one was dako jud, mura siya o dako sad siya sa orange. Dako siya,
Buogon?
mura
Buogon
duha ka fist like this.
Oh no.
So
Yes.
operahan.
I would also take this opportunity to reflect and pray also because the past president of POGS, Dr. Amorin,
Oh, yes.
also, yes. Even tayo mga doctors kami, hindi po kami excuse dyan. Alam namin ito. But then again, yun nga, the key to cure is early detection. That's why we are doing all these educational platforms for all of you. So, Doc, ang dami ng questions. We have
Sige, go.
so many questions, but I would say hi sa ating, hello, ate. She's my cousin from London, England. Hello, they are watching from there. So we are
Hello.
international.
Hello.
Anna Sus also from Davao City. Thank you very much. Ayan na, tanong niya, Doc Elmer Habagat, saan po? Asa po inyong clinic? Saan ang clinic nyo?
Okay. I used to have a lot of clinics go from north to south, but because of the traffic and especially because of the pandemic, I limited my practice to one hospital. Okay, lisod man magbalhin-balhin hospital ba you transfer from one hospital to another, the more you become it's very high risk for COVID transmission. So now I have mainly, and now I'm also being appointed as the new chief sa medical service, medical director, Southwestern University Medical Center. So dyan na lang. But if I called, I don't have another clinic. If I called in other hospitals, sometimes I go, sometimes I don't.
Yes,
University.
you will see him sa elevator sa Southwestern. Those of my patients who delivered in Southwestern, he is that guy there in the elevator sa picture, di ba? Hello, Marie Joy from Dumanhog. Thanks for being with us. So now we will answer questions related to the lecture. Those with gynae questions, I will answer later, I promise. So ito muna, from questions for Dr. Habagat. Sabi ni Marie Joy, if hereditary nga na ay breast cancer, older sister na chemotherapy na siya, na ay possibility, kami tanan magka-breast cancer pod?
Okay, if you have siya
Sister
siya
niya. Bisaya siya.
no,
Okay lang.
siya kani sister. So ang sister is a first degree kini siya first degree nga
Relative.
relative. So far siya raman, but it's very important that you will have yourself undergo kato ba itong i-mention o pwede ko mungutan na pila yung edad.
Yes, Mary Joy. How old are you? You
Pila,
can chat
pila,
again.
pila yung edad sa iyang sister nga na-discover, probably you can have yourself subjected to the same screening. Posible ba nga kamutanan? Di sa takaingon nga kamutanan, but ang risk nimo, Mary Joy, compare sa risk sa Y igsoon, compared to the risk of somebody who walay family member, medyo musaka imong risk. That's why you have to be very aware of that.
Cautious.
Cautious ka. So, subject nimo imong self to the different screening procedures. Kaya naa naman ka-igsoon. Now, if you really want to know if may possibility nga kamutanan, then although mahal kaayo, we can send you for BRCA1, BRCA2 testing. Pero I think that's uncalled
Especially
for.
pag young, yung sister niya.
Very young sister nimo. If your sister was
Okay.
very young, chemotherapy siya, then we, especially naanapod sa PCAS breast, like bilateral breast, then we can send specimen for BRCA1, BRCA2. And if positive ka, then you have to think about prophylaxis.
She's 30 daw. Sabi niya, she's 30 now. Perhaps she
Ah.
can start na po,
Okay, breast self-exam. Breast
Ayan.
self-exam and then,
So, Doc, another question.
Ay, pero, yes.
Sorry. Go ahead.
Okay.
Sorry.
Yeah, for 30 years old, we dili kahit maka-recommend sa mammogram sa less than 40. So what we recommend is ultrasound.
Yes.
Hindi ka magpa-ultrasound, Joy.
Oo. Most young patients, especially the medyo malaki din, so we recommend breast ultrasound. Tama po ba, Doc?
Yes, ultrasound for younger than 40 for that reason.
Okay. Si Anna is asking us food spot to help stop siguro, to help stop siguro the mutation of the cancer cells, or sige, Anna will try to answer ano bang
maka-cause ng mutation.
Or maka-increase siguro sa mutation, baka ito yung tanong niya.
Yeah, or masin. Pero anyway, ang food, dili man siya maka-cause of mutation sa breast. Katong na-establish nga maka-cause of mutation, really, nga high risk yun, katong radiation exposure. But, kanang high risk sad kanang high fat intake, obesity, kay ang hormone nga estrogen is a fatty type of hormone nga siya. Hormone which is derived from fat. So, yun sila, women who are on the obese side have a higher risk. But again, these are just risks. Doesn't mean you can get breast cancer. Because I have seen, niwang kaya nga pasyente, aggressive kaya breast cancer.
Oh, no. So, oo. But anyway, pag gusto mo, well, you can never go wrong in choosing the right kinds of food naman, di ba? So, yun na, we avoid those fatty food because again, si estrogen, gustong-gusto niya yon. The estrogen develops from, the fat cells. Ayan. So, before we proceed to the next question, hello, Ate Jean. Thanks for watching tonight. Ayan, ito, very practical question. Ang tanong, is wearing underwire bra every day trigger breast cancer?
Okay. This is a question that I always hear being asked each time. Although, that's why I have to go to my wife's closet and look at a bra that has an underwire because I cannot relate. So it's really a bra with a wire, no? Right. But I have researched a lot of this, and they always say no, it's nothing, no relation with having breast cancer.
So wala siyang relationship to breast cancer. Okay, ito is a clarification I think with the BRCA. Hi Doc. if ever positive, opera ba dayon or mag-undergo usa og immunochem, maka-explain mo further unsa ni ka-importante ang immunochem sa naay breast cancer. Ayun. I
Okay,
think the
immunochemistry,
estrogen,
progesterone receptor,
progesterone, receptor.
receptor
I think.
HER2. Okay,
Mm-mm.
after biopsy, ang biopsy report will show invasive ductal carcinoma, for example, which is the most common type of breast cancer. The next step that we usually do is to plan the treatment. Now, in order to plan the treatment properly, we have to know the hormonal status of the patient cells, cancer
Mm-mm.
cells, hormonal status. Hormone meaning estrogen receptor positive, one is siya immunochemistry, progesterone receptor positive, or the
Mm-mm.
human epithelium growth factor HER2 receptor positive. Because this is a bearing kaning whether positive or negative, like ARPR positive, HER2 negative, is the most among the breast cancer is the slowest, has the slowest growth, most receptive to treatment, ang AR HER2,
Mhm.
receptive to hormonal therapy. In the other hand, the other end is the negative ER, negative PR, negative HER2. Those are the most types of cancer. So dili sila mo respond to chemotherapy. Now, and this also sometimes means that instead of starting with surgery, if you have this immunochemistry result, we can start first with chemotherapy, then observe whether the tumor will respond, then do the surgery afterwards. So actually, mga guide ni siya. Also for prognosis, guide in the treatment. So it's very
Mm-mm.
it's
Mm.
part of the diagnostic diagnosis diagnostic request that we do after a positive result. We request for ERPR and HER2 immunochemistry.
Amazing. Actually, I'm amazed by most questions na ngayon of our patients because definitely their questions are seems like they
They
have
have read
read ahead.
and
Oo. So,
they want that
hindi na pwedeng doktor ngayon na basta yan. Doctors
answer.
should also be able to explain. There is a question. Pag benign po, is there a chance na liliit daw? Ba daw? Kunwari
Uh,
benign. Tapos, may chance ba na lumiit?
there are daghan man klase nga benign, no, wala ko slides. There are a lot of benign
Mm-mm.
benign sorry, growth in the breast. In fact, most of the growth sa breast, 8 out of 10 are benign. About 2% or
Mhm.
20% or 2 out of 10 are malignant. So what are these? Fibrocystic, which is common among the kanang mga medyo ni edad na ba? Fibrocystic lang, fibrous, then may maliliit na cyst. We don't do anything
Mm-mm.
about that because it's part of the growth and involution of the breast. Now, in very young patients like 20, 21, 22 years old, even 24, there's a very common tumor that also will grow, which is benign. It's called fibroadenoma. It's not malignant. It grows very slowly. So this is what I usually recommend. If it's very small, and then they say if you read the literature, the patient gets pregnant because these are young patients. Very small patient gets pregnant. Sometimes they disappear. But
Mhm.
I just tell them it's if it's 2 centimeters, or if it reaches 3 centimeters, I think the likelihood that it will disappear is slow, very low. Murag naana ko na siya,
Mhm.
and then slowly growing. So my recommendation is let's remove that, take it away from your concern. It's about 2 to 3 centimeters. That's big already. I'm sure it's benign, so I'll just excise that, and then of course I submit the tumor to the pathology lab for examination, just to confirm. But we can already tell that it's benign during physical examination and by the age of the patient and the history. But for small ones, I usually don't recommend removal. Just to set up.
Oh, okay.
Some of them rule fibrocystic disease, they just disappear. And,
Okay. May isa pa daw talaga. Are flat-chested lower chance to develop breast cancer kasi nga hindi masyadong
okay,
malaman.
very nice question. The
Victoria's
size of
Secret
the breast.
model ang question.
Ako daw breast. I'm sorry. The size of the breast, actually, the size of the breast is not, if you kanang tanawon, if you look at the anatomy of the breast, actually the breast cancer will grow, originating na cells are from the mammary gland itself. The mammary gland, whether a woman is flat chested or large breast,
Or
endowed with a large breast, the mammary gland is the same size almost. Pareha na siya. Same number, lobules, and then excretory tract going to the nipple. What actually causes the variation in the size is the amount of fat that covers over the breast tissue. So there are may glawas pero dagog baga og tambok. So raan po'y tambok kayo bro, gamay na pog tambok sa breast. Actually, what causes the variation is the fat. So even if you are flat chested, because you have a breast tissue there and you are a woman with estrogen, then you are still
at
subject
risk.
at risk to the rule.
In fact nga, I would say mas maswerte yung flat-chested because they can easily palpate.
Yes.
Kasi, di ba,
Yeah.
the struggle
Yes.
nga abong pregnant, we just had also in POGS, no, we also do this po, Doc. Yun nga ang problem, late nga yung diagnosis among pregnant kasi medyo bulky
Full.
yung
Full.
breast, yes, yung nung mga buntis po
Yes.
natin. Kaya
Pero,
siya medyo late
yeah.
na
Nasa siya,
diagnose. Sige po,
siya
pero
advantage. Nasa siya advantage. Right? I have a couple of patients who are well endowed, the cook breast, and the tumor is more than 3 centimeters pero nasa surface pa.
oh wow.
Oh, compared to a very thin-chested
So meaning
woman,
mabilis mag-crab out.
mabilis siya mag-invade sa underlying muscle. So yung patient ko, my patient just beside the nipple and he has large breast. So it's really nice kay hasta iyahang lymph node negative. Although 3
Wow!
centimeters. Wala siya kakuan ba. Oo, swerte sa ta.
Sana all.
Yeah, I remember
Okay.
her. I still remember her. Dugay na to na operan.
Oh, wow. So, there are some na blessed na nga, blessed din pag kahit may mask. Okay, so Doc, we are at the point where we will be giving free online consultation coupons to our viewers. Hopefully, masagot nila so that, you know, if you think male po kayo nanonood, hindi ko naman gagamitin ang consultation, you can share this free online consultation coupon to your friends, those whoever you think needs this. So, I invite everybody to try and answer. Very easy. Tatlo po. Ito yung, I think, mga takeaways sa ating awareness lecture for tonight. So, ready? Let's go, guys. Ready? And type in. Okay. Question number 1. Name one risk factor of breast cancer. Sa dami-daming breast cancer na nasabi ni Dr. Habagat kanina, kindly name one risk factor for breast cancer. Ready, set, go. Ayan. Hello guys. Okay pa ba tayo? Bakit nobody would like to get the free online consultation coupon? Ayan, ang galing. Hello, Tatiana Alexa Maristela. Do you agree? Tama ang sagot ni Tatiana, Dr. Habagat?
Yes. Yes, radiation.
Oh, yes. So, Tatiana, congratulations. Congratulations, you got the answer correctly. Although I'll show Doc because I think student po natin ito. Please let me know if I am right. Student ka ba namin? Ayan, no? Nulliparity, early menarche, late menopause. Good job.
Actually, the student is here as NIFA. Yeah, these are standard data part. Student, when you history of a patient with breast complaints, standard gini siya nga data that you have to include. Nulliparity, early menarche, late menopause. Learn something.
Wow, good job. Okay, so just to mention, ayan, galing naman, no? The answers are coming in already. Ayan, sabi niya, yes, Doc. She's really a student. Okay, got you. All right, now we move on to the next question. Ito, name na naman. Name one secondary preventive strategy for breast cancer. Again, name one secondary preventive strategy for breast cancer. Ready, set, go. Okay. I think kasi we have 10-second delay from the broadcast. So, we're giving you time. One secondary preventive strategy. Ano ba yung mga secondary preventive strategy for breast cancer? So, Doc, ano nga ulit, what do we mean by secondary preventive strategy?
Secondary preventive strategy are designed to treat the disease, discover the disease, diagnose very early so that we can treat it very early.
Okay.
In contrast to katong primary preventive strategy, meaning preventive, we know the cause, so we just avoid that cause, like smoking, lung cancer, then don't smoke. We do our strategy there would be no smoking campaign. But for breast cancer, we don't have that. So it's the discover early.
So we go
early.
for secondary. Ayan. So secondary preventive strategy, so meaning, paano ba nadidetect natin yung mass early? Ano bang mga strategies na pwedeng gawin? Di ba, na-mention kanina, may age. Anong age gagawin ito? Ganyan-ganyan. So, what are those? Mahirap ba yung question? Sorry. Parang, pang med school ba ang question? Amar, baka may answer na naman uli dyan. You might have an answer with you right now. Again, to our students, sana ba? Bakit we are a lot tonight? Nasaan na bang mga students natin at hindi nagsagot? Okay. Do we consider the answer na check-up, Dr. Habagat? What do you think? I think...
One, clinical breast exam starting at the age of 30. Check-up.
Okay. So, check-up na hindi lang check-up na magpakonsulta as question, dapat check-up with clinical breast exam. Ayan,
once a year.
Anne, I think
mammogram
this
starting at the age of 40.
correct. Ayan, congratulations, Anna Sus. You won one free online consultation coupon. Ayan, okay, good job. So, we are down to our last free online consultation coupon. So, again, type in ulit. Okay? This has been repeated several times. What is the key to cure breast cancer? Again, what is the key to cure breast cancer? Ready, set, go. Okay. Yes, you're welcome, Anna. Sabi niya, thank you, Doc. Okay, sabi ni Anna, thank you, Doc. The key to cure breast cancer. Paano na ma-assure tayo that the cure of breast cancer is maximum, na pagsabihin natin better prognosis, kahit we undergo this, we'll know na, I will survive. Let's see. Ayan! Nina Cardenas Umali, congratulations. You won the last free online consultation coupon that we will give away tonight. Early detection is the key for early cure, or for us to maximize the cure for breast cancer. Anything to add, Dr. Habagat?
Yun lang. That's it. It's very important. So some pearls to remember, items to remember. Our Filipinas, our women in the Philippines are at high risk, really. We have the highest incidence among all the Asian countries. But don't be sad about that, because we can do something. And breast cancer is very treatable nowadays, but the only caveat is we have to discover the disease at the early stage. Most especially kanang hindi pa ma-feel ba, mapalpate, wala pang bukol. And we can do that if we subject patients to early mammogram and other screening procedures that are just mentioned. Kato. So,
Yan. So once again, it's such an honor. Medyo, sorry, na-extend tayo konti sa time mo, Doc. I promised
no
1 hour, but I hope you
tech,
had fun
tech
with
problems.
the program.
Yes.
Thank you
Thank
very
you
much,
very much,
Doc.
Ad, for inviting. I was really,
So
sa
go
Department of
ahead.
Surgery sa Southwestern, nagkuhan mi. So, matong himuon. There are a lot of activities. So, when you invited me, sige, sure, go. We're actually
Wow.
planning a lay forum sa Southwestern. We're just another multidisciplinary session with OB, IM sa Southwestern Medical Center in the coming week.
Ayun.
Okay.
So, again, I know it's a Saturday night and we don't want to keep you any longer. Thank you very much for sharing. You can say goodbye to our audience, Doc.
Hello, and goodbye. Thank you very much for listening, and I hope I have conveyed a very good message for everyone. And I hope we
did.
learned something very, very important tonight for our health. Thank you also, Dr. Armiro. Tangpanan.
Okay, thank you, Doc. So once again, we are doing another Dangpanan session next month. Kindly watch out for it. And again, on Saturday is another session for Walk With Me. It will be at Southwestern University, ASCO. If you are around Orhelio, be with us, please. We'll be posting directions, instructions on what to do and what to expect on that day. It will be at 4 p.m. on October 15th, Saturday. Once again, this has been Dr. Shia Armero, ang inyong dangpanan. Always remember, it's not just medicine, it's also lifestyle. Goodbye!